episode 118, Video Creation Coach and New Technology. I'm your host, Dr. Justin Trosclair, and today we're Dr. Dave James Podiatrist Perspective. Join 2017 and 2018 Podcast Awards nominated host as we get a behind-the-curtain look at all types of doctors and guest specialties. Let's hear a doctor's perspective. Every Tuesday I'm here. I'm glad you're tuning in. We are smack in the middle of our podiatry series. So far the response has been good. If you have another series that you'd like to hear about, let me know. Eye doctor, hearing doctor. Yeah, I know there's some more special terms for it, but you get it. But don't just recommend a profession. Try to throw me a name or two, because some of these are difficult to find. The, dare I say, guru or someone who's, really killing it at the office. And it's like, yeah, I don't really coach or anything, but I've had some really good successes. I'd love to share it. So those kind of people sometimes are hard to find. And I want to bring, a lot of value. But with that being said, if you yourself feel like you have a good story to tell, by all means, shoot me a DM or an email and let's talk. Like I mentioned, today is Dave James Podiatrist. We'll go over a few procedures that he did that I didn't know much about, like clear nail, swift microwave treatment, foot mobilization. So we'll go over a little bit of that in the very beginning, since nobody else has talked about that from the past guest. But then he's not just like a coach. His niche is actually video creation. And like when he was doing some personal development, he had a challenge. Somebody was like, hey, do this, no questions, don't skip a day, just do it, and let me know how it goes. And so he's just been doing this since about 2015, and he just wants to encourage more podiatrists to do it. Sometimes, you just need somebody to not only hold your hand at the beginning, but then kick you in the pants because you're not doing it consistently. And once you get used to it, it gets easier, and then he can really help you with like ideas for content creation and all that kind of stuff. I really like later on in the show, the schedule that he says you should do to begin with to get started. Also an idea about banding your profession together to do like a social media blast and how that can work for everybody. Even if you don't agree with certain parts of maybe the infographic or, if someone does a video and you're like, well, I like everything except that minute 1.42, so you know what I'm talking about once you listen. And if you like that idea, I say take it, implement it in your field. Let the eye doctors, the optometrists unite and make a social media blast across America and the world about whatever you want. We even cover pricing, not of his services, but of actually your clinic prices. It's always fun to see, should you stay in the middle? Should you be higher? Should you figure out kind of what your value is and then work backwards? So we'll go over his view on that. He lists a whole bunch of people, whether it's books or other podiatrists that are making waves that have caught his attention on social media. He's got the British accent. So for me, some of the names were tough. That's why I didn't put down a lot of his podiatry names on the show notes because I just couldn't catch them. So you might do better than I do. If you do, let me know. I want to share with you reviews, testimonies of things that I've heard. Here's one. PJ, he's a big fan, but he's also got a really cool story. So, we interviewed him and here's what he had to say. Man,
you are doing great work. I've been listening to your work. Man, I admire you doing what you're doing, building the brand you're doing, bringing people together, educating us. Although chiropractic is a theme, but you're obviously including marketers and influencers, and which I really love in the medical space. I just listened to your Ben Baker interview, the marketing, branding, personality guy. I've been scribbling notes, getting smarter and smarter about what he had to say, and agreeing with mostly what he says, a lot of it, with a couple caveats from our business experience. But I don't know. I admire what you're doing, and I'm not ever going to try to do what you're doing. But as you know, I've started a podcast which is designed to help knee patients. And so I'm taking a card from you a little bit in what you're doing with this little tiny world of knee surgery recovery. And anyway, I just like what you're doing, I guess. I tell you what, when we included your little awesome promo, by the way, super awesome, it makes my podcast feel so much bigger because you're there. But there it is at the button at the end of an interview, and it's boom, there you are. I'm Justin Trosclair. Yeah, and it's got like, whoa, these guys are kind of for real kind of thing. So it helps me, believe it or not, having you as an advertiser, and it's such an appropriate and well connected kind of thing.
All right. All the show notes can be found at adoctorsperspective.net/118. Let's go. Hashtag behind the curtain. Live from China in Birmingham, United Kingdom. We got a great guest today. He had a practice that he just got rid of in December, so we're definitely going to want to know about that. He is now kind of switching into the mentoring, coaching. He also teaches some, so he's doing all kinds of fun things. So we got a lot to talk about today. Please welcome Dave James Podiatrist.
Hello. How you doing?
Doing great. That's a little joke, guys. The UK has a very limited way of you're supposed to say doctors or not doctors, and I don't want them to get in trouble. And I'm guessing that could happen, so that's how we do it.
No, we won't get in trouble. Doctors not a protected title over here because we have people who are tree doctors or tree surgeons. So yeah, just that. Unfortunately, our qualification doesn't give us that doctor level.
You are in our heart because we know what you went through.
I'm special in many ways. Yeah,
very special. Well, I like to begin as everyone does. How did you pick podiatry of all the things out there? And then if you want to touch on to the, why you ended up, transitioning back out of it, and then we'll revert back into asking you a couple of the specifics that I know you did that I don't know about, and I think the audience would be curious to hear about as well, like some specific stuff that you did.
Yeah, cool. How long you got?
Oh,
days.
4 minutes.
Let's 4 minutes. Okay, 4 minutes. You're not going to get much for 4 minutes. Okay, so I actually started off being a patient of podiatry first of all. So medical history, the simplest terms are I had spina bifida and I had a club foot, and I had two major bits of surgery before I was at school, so sort of 5, 6. One to correct the club foot, one to kind of plug the nerves back in on my back. And that was cool. That was cool right the way through school, right the way through adolescence and teenage years. And then I got to 20. And after a really cool weekend in Paris with my dad and a couple of his mates and plenty of alcohol, I did a lot of walking. And when I got home, about 2 days after I got home, my left foot started to become really sore. And when I looked at it, there was a huge blister underneath. And while hopping around my mom's kitchen, I slipped over and I banged it down on the floor and it popped. And underneath was this massive ulcer. And that's a bit of a shock when you're 20 to find out you've got a hole in your foot that you didn't really know about. So after that, I went and saw my nurse at my local GP, my doctor's surgery, and she treated it for a couple of months and then just said, look, I can't do any more with this. It's out of my skill, so I'm going to refer you to a podiatrist. And the first thing I did was went, well, what's a podiatrist? And she said, look, go and find out. It'll be fine. So saw a podiatrist, and they were brilliant. Louise and Paul, they're still friends now, and I actually went to work with them when I qualified, and they sorted out my foot. They healed this ulcer over about 18 months. And it was fine. It was fine for about 7 or 8 years until I then had another ulcer in the same place, which was, as is always with these things, it was worse. I had infection. It wasn't particularly pretty at all. Now, when I had the first ulcer, I was actually a computer programmer. When I had the second ulcer, I'd actually gone and done nurse training, and I was an A&E nurse. So I was working in the emergency department down in Oxfordshire. And so things were completely different. And when I'd done about 3 years in A&E, and I suddenly thought, you know what shall I go and do? Shall I carry on with nursing? Shall I, go and train as something else? Shall I leave healthcare? And I had a conversation with my podiatrist, who I was still seeing for kind of maintenance and routine care, and said, well, what about podiatry? And she said, yeah, give it a go. So I went off to podiatry school for 3 years, and we moved back from Oxford, where me and my girlfriend at the time is now my wife were living, and came back to the Midlands, where both of our families were from, trained to be a podiatrist, and I suppose the rest is history in some ways. But podiatry's been good. I got my degree. I ended up working for the National Health Service. I started my own private practice. I did a master's degree in biomechanics. Kind of chocked up all these really cool and interesting things. And when my private practice was getting on to about 8 years old, I think I got to the point where I went, this isn't where I want to be. This isn't the thing I want to be doing. And I developed this very keen interest in personal development, very keen interest in teaching and educating. It's kind of one of my strong values is learning. And I thought the only way I'm going to be able to do more of this is to sell my practice. So December of last year, December 2018, I sold my practice to a very good colleague and friend who's going great guns with it, and she's entirely suited for it. And I've now moved into coaching, mentoring, public speaking, education, and I'm really enjoying myself. It's like a natural progression almost. And after having 25 years of working in healthcare, it's nice to see that progression moving forward. So yeah, it's been an interesting career so far.
That's really interesting because you've chose to learn multiple stages of your life where a lot of people will say, look, I'm 25, I'm done. You know, I got what I got. I'm not going back to school. And then you did it again around 31 and you went to get a master's as well. So obviously you got a drive to learn lots of different things, which is really cool. Let's do real quick. I'm curious about a few things that you offered. I've had a few podiatrists on. No one's talked about these type of therapies before. So let's learn a little bit. And then I want to talk about like, how are you trying to get clients and marketing and some of the lessons and things like that. Sound good?
Yeah, absolutely. Yeah, it'd be brilliant.
All right, Mr. Magician. That's his shirt. Foot and leg magician. That's what his shirt says.
It's magician, not miracle worker.
Sleight of hand. So, okay, there's this thing called Swift microwave therapy. It looks like it's for skin lesions, for podiatry and dermatology. It's microwaves. What's going on?
Cool. So microwaves, for anyone who kind of gets physics, microwaves, basically they agitate water molecules. So as a friend of mine says, it excites water molecules, which makes an amazing T-shirt. And so when we have patients with verrucas, and for us as podiatrists, it's licensed for verruca treatments, what we want to do is do two things. One is we want to create some kind of inflammatory response within the verruca, which is where the excitement of the water molecules comes in. But also with the heat, we want to create a very localized immune response. And there's loads. I mean, when I talk to patients and students about different treatments for verrucas, I will often draw on a whiteboard. I'll write down all the different treatments with a nice little diagram of the skin and how they affect them. And out of those 7, maybe 8 treatments, there's probably only... there's only the first one is time. If it's not causing a problem, leave it alone. You can then start looking at things like needling, which is where we introduce a needle into the skin under local anesthetic and repeatedly, and that's good for creating inflammation. But Swift is really cool because although it's uncomfortable and painful, there's no real downtime. People can come into your clinic or your office, they can have the treatment, they can be out in 15 minutes and getting on with their day-to-day life. And I have to say the results I saw when I was in clinical practice were brilliant. I mean, we're not talking 100% for anything, but certainly with the lack of downtime, with the time between treatments, which is usually a month, and say between 3 and 4 treatments, you get some really good resolutions. And it's nice to have a really modern, contemporary piece of equipment out there which you can use for treating these skin lesions, which verrucas are a nightmare to treat. They do their own thing. They really do.
Is that a UK term for something else, or is that something that like podiatrists would know? I'm not really sure what a verruca is.
Verruca, so plantar wart, human papilloma virus.
Oh.
Yeah, we make, well, I don't know whether we make up words in the UK. Maybe we do, I don't know. But yeah, so verruca would be a wart or a human papilloma virus on the plantar surface of the foot.
Okay, perfect. Now we're on the same page.
Yeah.
We gave it a go. No, we gave it a go. Like, who does that? Nobody does that.
You can take that bit from the end and put it at the beginning.
Yeah. We'll just leave them confused for a little bit. Okay, that's great. Now we got a clear nail, which looks like micropenetration with medicine. Yeah. What's that for?
Yeah, it sounds really exciting, doesn't it? The simplest way to put that is if we're treating a fungal nail, so... that's a nail which maybe's had some trauma or some damage and a bit of athlete's foot fungus has got into it and it's starting to change the nail plate and the nail bed. What the clear nail does is it allows you to drill small holes through the nail into, I was going to say into the nail bed. I don't mean that. It's not into the nail bed. It's through the nail to allow you to put a chemical straight away through to the nail bed, which is where most of that fungal infection of the nail is.
So you actually get to the problem.
Yeah, absolutely. Most treatments are you kind of thin the nail down and put it on the top, but it's recumbent on actually that medicine being able to penetrate through the nail, which it generally doesn't do. Or you're looking at oral medication, which is it's not the best. The standard line is it affects liver and kidney, but I've seen all kinds of things. I've seen allergic reactions. I've seen gastroenteritis. You get a change in taste. So if you like your food, suddenly your food tastes different. So the thing about fungal nails is they're another thing which can be very, very difficult to treat. And clear nail is basically, as you say, it's a way of getting the chemical right to where the problem is. And I've seen some very good results with it. Some massively good results with it.
Well, that's good because, we see some crazy nails, at our office. Everybody's wearing sandals and these patients are from the village. So you see some things you're like, wow, you have done zero health for your feet for a long time to look like that. Yeah. And so I can imagine sometimes you just need to drill in there, deposit it, and let the medicine actually work where it needs to be at. So that's pretty cool.
Well, it takes time. I mean, you're looking at, if a nail on average takes 12 months to grow out, you're looking at treatment over a longer period of time, just to make sure that you kill that fungus, and when the nail's grown out, there's no fungus in there at all. But the recurrence rate of fungal nails, in my experience, is quite high. So even if you get rid of it, at the beginning of 2019, 2020, 2021, you might find it comes back again. So yeah, they're quite hard to treat.
So that's what's kind of nice about podiatry. There's a lot of repeat business, whether it's ingrown nails or fungal nails, or they got to kind of come back every 6 weeks or so.
Yeah, I mean, the gold standard for say, treating a fungal nail, in my very limited experience, is surgery. Get rid of the nail, kill off the nail bed with a chemical called phenol, and the nail doesn't grow back. But that's not to everyone's liking if they want something nice to look at. But yeah, a lot of podiatry is that, those returning patients for maintenance. And a lot of our patients are, retirement age, so 60 plus. We've got aging population over here, and certainly there's a need for foot care. And people want to have their feet looked after by the best possible people to do it. So yeah, we see a lot of that stuff.
Yeah. We had a lady on a while back, Dr. T, and she specializes in the surgeries. Like, she's the person that's like, look, you didn't take care of your toes, now I got to chop them off. Or maybe we can save it, or like give you half a toe. You know what I mean? And so there's a whole realm of podiatry that you can go down. So it's kind of fun to always interview different people, because you're like fourth or fifth podiatrist and no one's talked about this type of stuff. So
yeah, it's really interesting. And that was, my experience of getting into podiatry was from the wound care side, being a patient. My interest has always been MSK, musculoskeletal podiatry. But at the same time, when you're in a private practice, you've got to have this wide range of stuff which you can treat, because you don't know what's going to come limping through your door. And it could be a nail problem, it could be a skin problem, it could be a biomechanical problem, it could be something completely different. So having a wider range of skills really, really useful.
And talking about musculoskeletal and those types of things, I didn't know y'all had this foot mobilization technique level 1 and level 2. You go getter. What are those? What does that look like?
So, I mean, if we're talking about osteopathic and chiropractic techniques, so we're talking about mobilization of joints, and
right.
I suppose we're not trained at undergraduate level in that kind of thing, but if we're one of the things which we were always sold on was the subluxation theory, the idea that something is partially dislocated and you need to put it back. And we know that just doesn't... That's not right. Doesn't cut the mustard at all. But it's something which is still talked about even now. But we use it mostly for... I'm trying to think of a couple of patients I can give examples of. We use it a lot for pain modulation. So if you have somebody who has a stiffness in a joint where they're getting pain from it, my wife, if she ever listens to this, she gets a very, very stiff big toe joint, and the mobilization makes a massive difference to her comfort. That's been fantastic. It's been great use for that. But also at the same time, I've got a patient who has significant scarring from surgery for a diabetic ulcer, which he had a while ago, and we use mobilization for his ankle joints and also for his foot joints, and he gets a massive reduction in load across the area which is scarred, and he just gets so much feedback, and it does actually help with him. You can see a visual change in the color of his feet, and it for him it just changes the way he walks and makes him feel so much more comfortable. We use it, I have used it in the past. That's a lot. Fantastic. Yeah, and I there's no way I can say as a research study that I have researched this and it's empirical, and it is empirical. It's what I've seen. And the feedback from him is fantastic. And I would never turn around and say to every patient that joint mobilization is this wonderful thing which does everything, but it's certainly got a role. And I find it really useful with patients who are going through, orthotic therapy where we're changing loads. So, plantar heel pain, plantar fasciitis, it can work very, very well with that, while, adding a loading program and a rehabilitation program and adding soft tissue work and adding orthoses. And you put all this together, it's a very powerful package. But like most things, it's not that one.
Not everybody.
Pull out and go, I have one thing and it will sort everything out. I wish it was. It would be great. But I find it really valuable as part of my practice. And certainly from a practitioner perspective, it's been amazing. It's been amazing for my palpation skills, my appreciation of joints and a movement of joints, and how everyone is different. And it's been really, really useful for that. And I'd say to any of my students, if you get the chance, do a joint mobilization course, because it gives you that perspective. It gives you a different way of looking at the foot. Really cool stuff.
That's great. I mean, obviously as a chiropractor, we look at that and sprained ankles, and if they don't have good plantar flexion and extension, the talus is locked up. You give it a nice little distraction, and all of a sudden they got full range of motion. You're like, okay, well, that's good.
I've seen some absolutely miraculous, changes, which I can't, even as a foot and leg magician, I can't explain. But then I've seen people where we've done mobilization, distraction of joints, and nothing changes. It's a very specific thing. I mean, I see a chiropractor and have done for, blimey, I told someone the other day, 25 years, and they said, what, they haven't fixed you yet? But I'm on my third chiropractor at the same practice, and probably since the time it's actually nearly 30 years now, since I was sort of 16, 17, when the spina bifida type problems, the lower back symptoms started to play up. And I have to say that seeing them on a regular basis has allowed me to work at the emergency department as a nurse, to be active as a podiatrist, to do sport and things like that. So I'm massively grateful for what they've done. So it makes a big difference to me personally.
Yeah. My brother was spina bifida, but he had a worst case scenario where it was like scoliosis and had to have a shunt in his brain and all this just a big mess. So it's great to see that there's a range, where you
massive
just a little hair tuft on the back, or like what you had, a little surgery, not a little surgery, still a major surgery. But, after that, you're kind of like, well, I'm kind of done. I didn't have to go back to lots of surgeries, and I was able to do what you want to do in life, except for that foot.
Yeah. Well, it's interesting because there's a group I'm in on Facebook, which is it's called Shine, and it's for patients or for people over 40 who have spina bifida. And I go into the group and I actually feel like a bit of a fraud because, here I am with, okay, my foot's a bit dodgy and I got one leg thinner than the other and a difference in leg length and I limp a little bit. But on the whole, you wouldn't know to look at me that I've got spina bifida going on. There's people in the group who, like you described, they've got a shunt for hydrocephalus. They're bed bound.
Wheelchair bound.
Air is 24, and they've got issues.
They could be diapers too.
Yeah, they've got issues with pressure sores and incontinence. And I look at it and go, you know what? I'm doing pretty well. And I'm in this group thinking, should I actually be here? But we're all part of
you need your own support.
Yeah, absolutely. I go as a podiatrist and get told off when I make recommendations, but that's a whole other thing.
Oh, okay. I'll just sell Mary Kay on the side. Fine.
Yeah,
promote that then. Golly,
well, it looks pretty.
It's true. All right. Let's switch gears. Now we're gonna go into Dave the coach. Okay. He's transitioned. He's sold his clinic. He's ready to tackle it. He's teaching these kids. So what are you finding that's like your niche? What is your mindset that sets you apart, that made you think like you have something to give the world?
I think the biggest mindset thing is it's going back and it's doing the inner work, and that's a very coaching phrase. But back in about 2015, I had I kind of realized if you think of yourself as a car, and the outside of the car was gleaming and beautiful, and the wheels looked lovely, and it was polished to perfection. It was great. But when you lift the bonnet up, the engine was just a mess. And I realized in 2015 that the engine was a mess. And although things looked good on the outside, they needed some work. So I've done a fair amount of personal development and coaching. And I kind of realized that when I did all that, it made a massive difference to me as a businessman. It made a massive difference to me as a human being, and a massive difference to me as a father and a husband and a son and all that kind of stuff, all that sort of cheesy stuff which goes with it. And I found during that whole process with one particular coach I had, a guy called Danny Clark, that I had a bit of an enjoyment of video. I liked getting on video. And when I got on video, interesting things happened. People started to notice, and people started to pay attention. But when I took that a little bit further and went, okay, if I'm on video, if I try and turn up on video as me, as the authentic Dave, whether that's Dave swearing, Dave ranting, Dave being nice to me, it doesn't matter as long as it's me. A friend of mine calls it the coffee version, and drinking tea would be the tea version for me. I suddenly found that it got really, really interesting. So I suppose based on that, my niche is more around getting podiatrists, getting people in the foot health industry to start using social media, to start using video to show the patients the real them. And that's useful because if you see somebody on video and then you see them in real life, you've already got one step closer to knowing them and potentially liking them and potentially trusting them. And if we're looking at that whole buying cycle, then you're more likely to get custom from that person because they've already gone through those emotional stages. And it's very similar to if you have we've just having the sad news yesterday that the lead singer of the Prodigy he's died at 49. And I remember,
really? I didn't know that.
Years ago now, I like the Prodigy. They're brilliant. There are some people who feel very, very close and will feel a great sense of loss because they've seen him in the media and they've seen him on TV or maybe seen him on at concerts. And it's that exposure to people on a regular basis before even if you've never met them, which creates that emotional bond. So for me, video is a massive, massive part of that. And that's my niche. That's where I sit, trying to get people onto video more, trying to get people to be seen and be visible. And when they're visible, truly amazing things happen. Things you just don't expect.
I want to go back to that. It's interesting the news cycle that you're on. We got Luke Perry.
Yeah, 52.
He died of a stroke yesterday, and today's Mardi Gras that we're talking. So I didn't even know about Prodigy. They were kind of had a couple hit songs to us. Maybe they're still producing music, but it's really interesting. The Linkin Park guy. I'd never shed a tear for these guys. I'm like, I don't know you. You know what I mean? I'm just not that person that's like, if I knew you, that'd be one thing, but I've never had a coffee with you or anything, but that's neither here nor there. Your point remains, and that's what we're going to dig deeper into is the video. With a podcast, if I were to ever meet someone that I listen to or interview them, I feel like I know them, and they don't know me from anybody. And I'm like, I know about your kid, I know about this, and it's kind of an odd feeling. So when we're talking about videos, are you saying, here's what a clear procedure looks like? Here's what this looks like. Or are we talking like a selfie video, walking through the park or talking about some foot condition, or all of the above? What do you think?
All of the above. Anything and everything. And 2017, I did a bit of video in 2015, and I've just recently been to an event where they're still talking about video at this event because people still aren't doing it. It's the usual situation. You have to say it again and again and again until people get it. And in 2015, there was an event up in Birmingham, and Google were at this event, and they were doing a presentation. And they came out and said, video is going to be the future. You should get on and you should do it now. And something must have clicked at the back of my mind. And I went, right, I'm going to start doing video. And the first ever video I did for my business was I'd taken my youngest lad out he was in a bike trailer. I was on a bike. It was in Cannon Hill Park in Birmingham. I'd cycled around a bit, and then I got a selfie stick out, put it up in the air and said, right, I'm going to do a quick 60 seconds to camera. And it was the most awful video you have ever seen. It was terrible. I played it to someone recently, and I'm just cringing. I'm just absolutely bundled up with embarrassment for it. And my little lad,
but I won't take it down.
I'm hearing my little lad going, "Say hi," and hi, and it was natural and it was good. And so from that point, I said, right, I'm going to start doing videos which I suppose are more professional. So I turned up not as the T version of Dave. I turned up as the professional podiatrist with a long list of qualifications and post-nominals. And it got a little bit of attention. People kind of went, oh, yeah, that looks interesting. But it didn't really take off. And then in 2017, when I took Danny on as a coach, Danny said, I want you to do 2 2-minute videos a day for 14 days. He said, no weekends off, just get stuck in and do it. And I was like, what? What can I talk about 28 different videos over 14 days. What can I talk about? And he said, you'll think of something, just get on with it. And it was kind of like the phone goes down and that's it.
Yeah.
And I went, right. So I just started doing it. So I just literally got my phone, got the camera on that. It was an old iPhone at the time, and got my camera out and just started doing pieces to camera. And it would be, I did 3 videos which were talking about what to expect from a biomechanical assessment. So, we take a history was one of the videos, and then we lie down on the couch because this is what we're looking at. And we stand you up because this is what we're looking at. And it went on from there. And it was the usual stuff, what's a corn, what's callus, what's a verruca, that kind of thing. And the fear goes after a while. Once you've been in front of camera, you start to get less fearful of it. You become less concerned about how you look and how you sound. And I realised that I probably have a face for radio, and I probably have a voice for silent films, but I became more comfortable with watching me and playing these things back. And I started to experiment. I started to go experiment with a few more geeky techniques, a little bit better camera equipment, a few cuts, a few edits, and that was good fun. I thoroughly enjoyed that. But I remember the most viewed video from memory on my Facebook page is one where I was putting tape on a verruca, and it had I'm sure it's coming on for about 4,000 views now. And I put a bit of tape on a verruca, but the patient didn't even have a verruca. It was one of my colleagues. And I go back and look at it and say, right, is that really what people are interested in? But it showed me that actually people are interested in education and information. And if you can give them that education and information without any anticipation or expectation of what you're going to get back, it draws people into your environment, your tribe almost, I suppose, if we're going to use a term to describe your community. And I just went from there. And people would say, that was a really interesting video on X. Can you do me a video on Y? Yeah, of course I can. And then it went into I even had videos where I did a series of stories on a Sunday evening where I would sit and read a children's story about feet, and did all kinds of things, and it was great fun. It was brilliant, and that's why I just love what video has kind of done for me in terms of my personal development, but also what it's done for what it did for my business and what it does for my kind of future business. Yeah, it's great.
So I started a YouTube channel. I'd have to double check, maybe 2009 or 2010. And they're like, you should have videos. Even back then, they're like, it wasn't like now where like, if you're not doing Facebook videos, what's wrong with you? But, the office tour, here's all the little different things that I can do. But my first video, like you said, it was St. Patrick's Day, and I was wearing a kilt to the office. And I said, hey, this is what I'm wearing to work. And that was my first video. And I left it up there just as a reminder. And, my cooking show, sometimes I'll cook like Cajun Chinese food. And, I was doing that for a little while, and you get some views, you get some shares. And like I said, just kind of being you mixed in with everything else that you're doing, I think is a good thing.
And it rises everyone. And, I say this to my colleagues, and I've said it a lot, that if everyone is out there doing, it doesn't have to be videos, but if everyone's out there doing social media and promoting the profession and the industry, that kind of critical mass, it raises everyone. And we've had it recently with a great kind of campaign where over 3 weeks where we're raising the awareness of what podiatrists can do for heel pain. And we've only had I'd say it's probably 30 people maybe at the primary end of it, 30 podiatrists doing it. But the ripples it's made have been absolutely amazing. Now, if you take those 30 podiatrists and you take the 13,000 which we have registered in the UK, and they all do the same thing, just imagine, that's like tsunami of social media. It makes a massive difference. It does make a massive difference. But at the moment, you stand out because of the video and the podcast you do. I stand out because of the video I do. Whereas I'd rather the whole profession just raised itself to a different level and was seen by patients, seen by customers, seen by other professionals as well.
Do y'all have a lot of infighting in your profession of videos are unprofessional, or I don't agree with the heel treatment that y'all are advertising, that's why I don't want to do it?
I get it. We get a little bit of it, but podiatrists are interesting, and I'll stick with the term interesting for now. We do have some debates about stuff. And because it's such a varied profession from, as you said before, people who are doing surgery, significant bone surgery, right the way down to people who are doing very routine care and on looking after people's simple foot problems, so, nail and hard skin problems. Not everyone's going to see our profession from, via the same eyes, same spectacles. And so, we get a little bit of infighting. But I think one of the things for me about podiatry is that we maybe hold ourselves back a little bit. The world's moving on very, very quickly. And the standards around social media, while they're important professionally, it's important that we step out of that comfort zone and we do something different. It's a pattern interrupter, so people can actually spot us. If we do something different, it makes a big difference. But we get a bit of infighting.
Okay, because I was just asking, because you got 30 people, there's 13,000. I was wondering if it's like chiropractic, where we got a good group of 8 or 9,000 chiropractors. But if we were to say, hey, we need everybody to post this amazing infographic, how many would actually you just have to hit the button, just the share button. That's all you have to do.
Yeah.
And I didn't know if it'd be kind of like a similar thing. Well, I don't agree with this, so it's fine.
Or even the share button. You can. One of the things I find is that people aren't interested in the source. They're interested in my interpretation of the source material. So you could share an infographic and you say, look, this infographic is really good, 90% of it anyway. I actually don't agree with these bits, and here's why. But
there you go.
Conversation point, but you're still getting that message out there. And it's not necessarily about getting every patient to come and see you. It's about getting every patient to pick the right practitioner for them. And you have lots of different chiropractors, lots of different views, lots of different podiatrists, lots of different views.
Yeah.
Every patient suits every podiatrist, and not every patient suits every chiropractor. And it's finding the right ones to come to you.
And let's turn it a little bit. You have to market yourself, whether it was for your practice or if it's for your coaching. You got to get your name out. Obviously, you're doing some podcasting. I assume that you're doing video, and if so, how are you tailoring your message for your marketing for that?
For the podiatry side, and for the coaching side, it's about offering value. It's about saying to people, here is something I have learned. It is yours. You can use it. You can do what you want with it. I want you to use it to promote you and promote the profession. Then, once you've got that in place, people start to get interested. And most of the time, what people need support with, certainly for coaching, is the implementation side. People are not very good at taking action. We use the term I know a lot. So you say something to somebody, I know that. But the question is not, do you know it? Are you doing it? So a lot of the time with the coaching, it becomes a case of implementation and a case of action. But the marketing is massively important. Just going back to the podiatry business, a lot of the stuff around the podiatry business, I thought originally that I was doing videos for my clients and my customers. And it turns out that actually I wasn't doing videos for my clients and my customers. I was actually attracting other people in my industry. And that was part of why I kind of went, you know what, this isn't where I want to be. Coaching and mentoring is where I want to go instead. And that was part of the whole process, which kind of turned my hand on that one. But for me, it's about offering huge amounts of value. And when people want that support and implementation, they want that accountability, they want someone to hold the hand a little bit and just help them forward. That's kind of where I come in.
Was there one of their one or two top concerns that they have they'd hire you to help resolve?
They're going to look silly on video. That's one of the biggest ones I find. Is I don't do video. My voice sounds funny, or I look funny, or that's one of the biggest ones we get. The other ones we tend to get are around changes in practice, and pricing always comes up. It's the pricing argument that if I change my pricing or I put my pricing up, or I'll lose customers, I'll lose clients, and that's I've been through that. I went through that mindset, 4 years ago. I hadn't put my prices up for ages, and then there was nothing I could do, and I had to go through that process. It's
more of a shock too when you have to jump it up that much.
Oh yeah, I mean, I put my prices up. I think my main prices up by something like 30%, and that's a massive jump in business. But in terms of the number of patients who went elsewhere, it was a very, very small change. Very, very small change. And suddenly you go, what was all the fuss about? Well, all the fuss was between my ears. That's when most of it goes on. But it's helping people to realise that the world doesn't end when you put your prices up. And actually, you put your prices up, it makes you probably less busy to begin with, which means that you've got the time to set your clinic and your services up how you want them to be set up. And it's turning people's mindset around. I know mindset gets thrown around a huge amount, but it's turning people's mindset around from one of kind of scarcity, that if they change something in their business, they're going to lose clients, to, well, actually, if you change something in your business, you're going to attract the kind of clients that want to be around you, and you're going to attract the kind of clients that you want to work with, and your results will improve as well. Just very, very, very big change on that.
When I was in Colorado working, I was charging like 45, and then went to China, came back to America, and I was like, I'm going to charge 50 now. It's like, yeah, I'm going to do 50. I was talking to a buddy the other day. They're charging 65. I was like, whoa. I was like, my goodness. And so I was like, all right, well, I need to make sure I keep note of the prices that other people are charging, because you don't want to be lower than everybody, and you don't really want to be in the middle either. I don't know your theory on that. Sometimes you want to be a little bit higher than the average.
Don't worry about what anyone else is doing. It's about value, and if you have a business which offers immense value to your customers and your clients and your patients, and that value has to be defined by them. It can't be defined by you, because when you come to that pricing decision, you bring your own baggage. Yeah. Would I buy a Ferrari? No, I wouldn't buy a Ferrari at all, because I don't see the value in a Ferrari. I think they're beautiful cars, but I wouldn't buy one. Would I buy a Honda? Yeah, probably would buy a Honda, because then I can see the value in that. Although I do love cars and I've had Hondas before, but you bring your own emotions and your own thoughts and your own feelings to the table. So one of my favourite phrases is, it's a Mark Twain. I think sure it's a Mark Twain phrase, where he says, "What other people think about you is none of your business." And we make all these decisions based on pricing, looking at other people's pricing structure, and actually, it's not the right way to do it. The way we should be doing it is we should be saying, what do I want to earn? What is a reasonable, or what is a nice figure for me to earn to have the lifestyle that I want? And then you work it back and say, how many patients do I need to see to get that? And can I see lots of patients at a higher cost, or can I see, a few patients at a higher cost, or lots of patients at a lower cost to get there? What are my overheads? You do it in that sense and decide what services you want to provide and what level of service you want to provide. So I'm not about what other people are charging.
Yeah. Okay. Let's go with this though. Let's say everybody else is charging between 60 and 70, and you're coming up and say, man, it's gonna be 110.
Yeah.
Okay. So what's something, but really you offer the same service. So what's the one way that you can increase the value that the patient perceives to want to spend the more money? Like what's like one or two things that we could, whether it's offering tea at the front desk or a hot towel at the end of the procedure or something.
Yeah, hot towel so you can go to the washing up for me. And it's a really interesting question. That's going to be very much an individual thing. I would say sit down and map out your customer journey. What is the ultimate experience that you want your clients to have from the moment they hear about you to the moment they've been treated by you, and what they're going to say to their friends and their family? And if you can map out that journey and don't just think about, I want them to come to the clinic and I want it to look clean. You want them to go away from the clinic going, that wasn't just clean, that was immense, that was spectacular. You want them to use almost like an exaggerated set of words to describe it. And yeah, if you're going to provide tea when they get there, don't just provide, one tea at builder's tea, as we call it in the UK. Provide the most amazing set of tea. Make it so they want to come and spend more time there. Make it so that everything is not too much trouble. And one of the things which I think we do miss on is we don't follow up on our patients enough. We see them in clinic, and while we're there, we look after them. But there's not that kind of aftercare. There's not that checking up to make sure that they're all right. Yeah, think of it as, if my mother was driving home after visiting me, I want to make sure that she was home okay. So I would either say I'd say to her, contact me, or I would contact her. It's that common, that common caring need.
Right.
If you understand what the most amazing customer journey is, and then you provide that the amount you charge becomes almost irrelevant in some ways. As long as you're covering your costs and making a living out of it, it doesn't matter at that point. So yeah, the service, if I'm a podiatrist, it might be I provide nail care, maybe exactly the same, but it's all the other stuff around it. That's the bit which makes the difference, and that's how you stand out.
I love it. That's the kind of part that I was hoping you would answer, because that's the part that, that's how you have to build, you build value. I'm trying to, have a book, and I try to sell it under, like, you got to create a value, and what else can you offer, and what's the next ring on the ladder that you can offer. And I'm like, man, I don't know. I got to really think about this and map it out. And it's not easy work. So to have a coach to help you through that is going to be very beneficial in the long term.
Because you do. I mean, I'm sure you're going through that process and going, no, that makes me feel really uncomfortable. I don't want to do that, or I can't think of what to do next. And what the coach does is the coach says, look, I've been in your shoes. I know what it feels like, and I know what you're going through. Let me give you that support to help you through that point. Or let me just tell you that, look, everything is going to be okay. And what you're feeling at the moment is perfectly natural.
Yeah.
But you need to feel that in order to get the benefit at the other end. Yeah, it's that kind of support which goes with it.
What were some of your influential guides, authors or books or other podiatrists that you were mentored under that's really shaped the way you think about different things?
It's interesting. I see a lot of my kind of mentors and coaches are outside of podiatry, and it's not a deliberate thing. It's just the way things have gone. In terms of authors, I love Gary Vaynerchuk stuff. I have to say, I really, really enjoy Gary Vaynerchuk stuff. I will read anything personal development of his, because I think it's just, and even though it's not designed as personal development, it is, because of his approach to customer service, his approach to you make your clients happy at every opportunity. And you just show massive amounts of value. You step out to make them happy at every point. Nothing else matters. That is the most important thing. And then when you've got that customer loyalty, then you have that permission to sell to them. So I like the Gary Vaynerchuk stuff. And I've got, so it's podcasting, no one will be able to see behind, but I've got 3 or 4 shelves worth of personal development books in the background, some amazing stuff. And I'm really enjoying at the moment a lot of the Malcolm Gladwell stuff.
He's good.
So he's good. Yeah, I mean, Outliers is one of his. That was fantastic. Tipping Point was the one I've just read, which was great. And it talks about thin slicing, the idea that you take a small bit of information and can make a big decision off it. And that reminded me very much of my emergency nursing days, where somebody would come in and you have 4 hours with them to take them from finding out what the problem is, offering a diagnosis, giving them treatment, and then either sending them home or sending them off to somewhere else. And you get that in a podiatry clinic. You don't get long with your clients. So you have to be able to make a difference to them very, very quickly and understand what their needs are. So Malcolm Gladwell stuff is absolutely amazing. I'm just trying to think. You got me on the run now. You see, that was one of those questions I was never expecting. So I've got to take a look at my board now. But anything personal development for me is just spot on. I love the sort of the Wayne Dwyer stuff, where you're almost looking at life and taking it as, yeah, that's cool, that's not a problem. The Jim Rohn stuff, where it's about you're the average of the 5 people you hang around with, and that's sort of the book stuff that I look at. Do you know, it's really interesting. I'm listening to an audiobook at the moment called They Ask You Answer by a guy called Marcus Sheridan. Really interesting book. And it kind of embodies, I didn't even mention that book, did I? There you go. See, I mentioned it afterwards. And it kind of embodies that whole idea that if you have complete transparency in your business. So, for example, as a chiropractor, someone might turn around and say to you, well, okay, what exactly do you do as part of your assessment or your adjustments or your treatment? And if you say, actually, this is a good example of what we do, people go, okay, you've answered my question. There was one point where they were talking about putting on prices on your website. Now, I've never had prices on my website because I've always been that little bit shy that they'll see the prices and go, no, too expensive, and go somewhere else.
Not even going to call.
Exactly. But if you put your price on the website, because there's about 3 different levels of objection, isn't there? So there's the, I don't understand what's going on. I'm not sure about the person, or it's too expensive. And if you can put those 3 objections, you can answer questions which push those objections off the table, you've got more chance of a sale. So it's really interesting, not putting information on because you're being a bit sort of secretive or a bit, what's the word I'm looking for? A little bit kind of, not suspicious. What is it?
Elusive?
Yeah, elusive. You're trying to, this mystique, like you're covering yourself over, and people will go, oh, that's intriguing, I better go and have a look. It just doesn't work. People just go, yeah, if you can't be bothered, I'll go somewhere else.
Well, and when you're talking about the prices on your website too, one, your staff may end up having to spend a lot of time convincing them to see you. Oh, that's pretty expensive. Now that's a whole other conversation where if they just saw it online, you already weeded out the price shoppers, so it frees you up.
Yeah, and even if you've got an element where, if we're talking about Swift or Clear Nail, they've got a different price point. Nail surgery's got a different price point. You might have your rehabilitation has a different price point. If you just say to people, look, it's going to be complex to tell you every permutation of treatment, options and pricing. But I can tell you that if you want to come and see me, this is the amount you pay. Boom. At the beginning, and that is that's the minimum you'll pay. You'll pay that, and then whatever we decide to do after that, we will talk you through the price of that. And that seems to be a good way of doing it. So there's different ways of doing it. It's cool. If we're looking at other people, there's a guy called Rob Moore who's in the UK. He's brilliant. He's got a very no nonsense approach to personal development. I love his stuff. He's got a podcast as well, which is absolutely awesome too, and it's great listening to his stuff. In podiatry, we've got so many people, and for a small profession, we really hit at a higher level, and we've got people like Tony Gavin, who you've already met. Tony is wonderful for our profession with the stuff he does with Osgo. That is great.
That's huge.
Yeah, we've got huge educators as well out there. We've got people like Emma Cowley, or do I call her Dr. Emma Cowley now? I'm never sure. Dr. Emma Cowley down in Plymouth. Jill Halstead. We've got all these people out there doing really cool things. We've got people like Ian Linane, who's doing a lot of mobilisation in the UK. There's so many people doing so many things. And I have to say, I look at them and I go, there's little bits of what they do, which I just draw on for energy. So many cool people. I could just list off a whole host of names, Robert Isaacs, Belinda Longhurst. The list goes on. But they're the people who I see on my podiatry social media and give me really good energy and know that our profession is if we all work together, is going to be in a very good place. So aside from that, of course, there's the family. They always seem to get mentioned last, but there's so many cool things out there, and every day I find something else which I can look at, I can read, I can absorb, and I'll take something from it. And it might not be obvious at that point. I'm trying to think. We've got there's the three coaches I kind of work with at the moment. They're absolutely fantastic and influential. There's so many things.
That's what I like to hear. There's a variety. There's depth to it, and I'm probably not going to go and write all those people's names down. So. Listen to it again, write it yourself, and you can Google them and find them on Facebook or LinkedIn or wherever and kind of see what these people are up to, because we have our own like that in chiropractic. You find some names, you start Googling them, and you just sort of start following them on Facebook, and you start learning some stuff, and you figure out who's good with literature, who's good with funny memes, all kinds of fun stuff like that.
Oh, you want memes? We can get you sorted on those. But each of those people, and there's more names, and there's loads of people I could mention. It's not they're not excluded for any particular reason, other than we haven't got days. But they're experts and specialists and influential in their own particular field. And that's really nice to be able to pick on those bits and bring it all together. It's fun.
Yeah. Well, we're going to do a little more switching up because I know we got to respect your time. I like to take it a little bit personal.
Okay.
We want to know who Dave James is, the father, the husband. But first, vacation. It's tough to do sometimes. We got our own businesses. We're always going to be on the phone consulting with clients now. So how are you able to take more vacation if you don't take enough at the moment?
Yeah, it's interesting. When I had the business, I felt that certainly early on, you were there all the time for it, and there wasn't much time to take vacations, to take holidays. And it was 2015. I was just finishing my master's degree. My wife turned around to me at the beginning of 2015, and she said, "We've not had a holiday for 3 years. We're taking a holiday." So she kind of led that charge, and it was interesting because we went down to Wales, went down to South Wales, which is it was a place I used to go to as a child as well. But we had to come back out for one day to go to my graduation ceremony with inking. So even on holiday, we still got dragged out to something else. But my wife basically put her foot down and said, "We're going on holiday," and I went, "Okay, fine." And the reason I suppose I never really did holiday is that my week tends to be so varied, and I tend to do so many different things that I never get bored. I never get to that point where it's 9 to 5 Monday to Friday, fall asleep at the weekend. It's not that kind of thing for me. And that's one of the things I've pushed all the way through. But yeah, we have a nice holiday each year. We go away for a week. I try and take time off at Christmas and kids' holidays and that kind of thing. But mostly for me, it's about being around for the kids. It's about being around for their plays and school events and concerts, that kind of thing, that cool stuff. Making sure we get time for a holiday, making sure it has to be in the diary. If it's not in the diary, if there's nothing blocked off, and there's something comes up for me, it goes in the diary. And if you haven't got in there first, tough.
Yeah, stuff like that. Do you have any hobbies? Things that you do for stuff fun outside of business?
Photography. I love my photography. I don't do enough of it, and I suppose because I do a lot more of the video stuff, that I can that's okay. I'm still using a camera, I'm still doing something with it. But yeah, I love photography, and I think if I hadn't have got into hadn't stuck with podiatry and healthcare, I probably would have moved across more into photography. And so I love it. I started
like weddings or like
I did
landscapes.
I did a wedding last year. That's
a tough
way. Yeah, you want to see how high a man's heart rate can go for a sustained period? Go and photograph a wedding. But I loved it. I really loved it. And the people who the couple Phil and Amy who had the photos and that, they loved it, and that was awesome. But for me that was the challenge of executing taking photos, knowing that they're going to look at those photos in 12 months' time. And they're going to get memories which come back of their big day. And if I mess the photos up, I mess their memories up. So there's no pressure. So I did wedding. Wedding was cool. Love a bit of portrait photography. Really, I'm not much of a landscape person, but I love getting out to Birmingham when the sun rises up and getting some nice shots of Birmingham in the sunrise, sort of urban. I suppose it's urban sunrises. They're quite nice. But yeah, photography, it's one of the few things which has stopped me going to prison, I think, is photography, because it does keep me sane. So yeah, I love my photography. What else do I have? Love my reading. Cook a little bit when I get the chance. I cycle, although I haven't done much over the last 12 months. But cycling I really enjoy. It just gives me space. And music, I absolutely adore music. Anything classic rock, anything which slips into the prog rock kind of modern prog rock arena, that kind of stuff I love. And just
give us a prog rock band.
Oh, modern stuff. So things like Tool is one of my favorite bands ever, and they're not classic prog rock in any way. Porcupine Tree and Stephen Wilson, the Dream Theater twiddly twiddly stuff, which my wife hates. I love that kind of stuff. Really technical music and lyrics which they've thought about, and music which goes on for days, that kind of stuff. Yeah, I love that.
I gotten into EDM and those types of beats and everything.
Yeah.
My wife just puts up with it. Sometimes she's like, I can't take it anymore. You gotta turn it off. It's driving me crazy.
Yeah, so have some headphones and go away. Okay.
Yeah, I enjoy it. How are you able to keep the love alive so that you don't end up, divorced and sad?
Well, the joke I say to people at the moment is the reason I've got been married 14 years is that I know exactly what to say to my wife, and B, I'm never at home. So that's the way to keep a marriage going forever. I think is to be somewhere else. I honestly think it's about expecting that you're going to change, and we're going to develop and we give each other space. I love being around my wife, and actually it's great because she has a sense of humor which is able to deal with my sense of humor, and she's able to deal with me in my darkest moments, and she's able to deal with me in my most hyper moments. She's got amazing skill for that. I think it's when she worked in A&E, she had to deal with so many people. It's a similar thing, but it's it's accepting that over those 14 years, 3 children, God knows how many house moves, master's degrees, changes in career, all of those things, that we've both changed and we've both developed and we've both matured, and it's honouring that and it's accepting that, and also knowing that the place we are at the moment, if it's tough, isn't the place we're going to be forever. But I just try and surprise her with stuff. I will buy her the cheesy set of flowers occasionally, but a lot of it comes down to little stuff. It's turning up and saying, I can go and pick the kids up from school today, or I can take the kids to school. It's those little things which just change the dynamic a little bit for her. Or, you want to go and lie in bed? That's fine. Go and have a lie down. I'll get up and I'll deal with the house before. It's simple things like that. And it seems to work so far. I still haven't learned how to pack the dishwasher properly, though, it seems, even after this many years. But I think I
hear that.
It's out my reach.
Yeah. It's interesting. Giving each other space, I think that's hugely important. You got your own thing. I got my own thing.
Yeah.
But then expecting the change, that's important too. Like, you're not going to be the same person.
Yeah.
And the big piece, I think, is if you look at what does a housewife do from the 1950s, and you're like, all right, I'm going to start doing some of those stereotypical roles, it goes a long way, because for some reason, I think the stat was the wives are expected to work now 40 hours a week, but they still do 80% of the house chores.
Yeah, absolutely.
And that ain't good. So it's like, if you could just do that, it goes a long way.
My wife...
It's not like it's their job. It's just...
Yeah. My wife works far harder than me. And I get to go every day and talk to adults. She deals with children or a dog or both at the same time. So, yeah, I'm massively in awe of my wife's stamina and focus and everything. And then, 3 kids at home, and then she deals with me, and I'm like the 4th child. And she has to put up with that on a daily basis. But my wife is she's part of the catalyst as why I moved, I suppose, into coaching, because she went through a huge amount of personal development as well. And I saw the change going on in her, and you try and resist it. You're like, no, I don't need to change. It's fine. And then you see the positive effects which are coming from that other person. You go, I've got to change. But yeah, my wife's awesome. She's absolutely fantastic on every level. She really is cool. So yeah, she's
perfect.
She's brilliant. I even tell her that, to her face.
It's a shame I have to cut all this out of the interview. I mean, we just got to cut it for time, buddy. So sorry. So sorry, wife.
No. Love you, wife. Love you.
Please listen to my show. I talked good about you. No, but for real, that's amazing. It's good to see the banter. We're going to wrap it up here.
Cool.
Give us the website, more information. How can they find out about you and what's going on?
Okay, how can you find out about me and what's going on? So, Twitter, if you do Twitter, Dave the Pod, so DaveThepod. You can get me on Instagram. It's Foot and Leg Magician on Instagram. If Facebook's your thing, you can find me. I've got a few places on Facebook. So I've got my kind of business page, which is the Foot and Leg Magician. I've also got a coaching group which is called Stepping Up. So if you've got healthcare people who want to come along and have a look at that, more than welcome. I've got the website, so www.davethecoach.co.uk, and then there's the hello@davethecoach.co.uk as well. So you can usually find me in those places. If it's a professional thing, come and search Dave James on LinkedIn, if that professional thing floats your boat as well. But yeah, I'm usually somewhere on the internet, definitely. And there's even a YouTube channel floating around as well, but I need to work harder on that.
Hey, real quick, I was looking at your page, and it might be somebody else, it might be wrong. There wasn't much going on with the page, was there?
Which one, the coaching one or the Foot and Leg Magician one?
Dave the Coach.
No, there's not a lot going on there at the moment. That tends to be it's going to have more action at some point, but that tends to be that's where I keep my messenger bot on the Dave the Coach
okay.
page. So I'm collecting stuff there. Yeah, I need to do more of that. I need to drop some stuff in. But when I left the business, when I sold the business, that page originally was the business page. Last year, probably earlier last year, about I think it was about April or May, I went, right, I'm changing the name of this page, knowing that I was in the process of selling the business. And I went, I don't want to lose that chunk of people who followed me in my videos over the years. So that's why it kind of came across. So having the coach page and the Foot and Leg Magician page, they're kind of like, I don't know which way to go. So it has,
Oh, yeah.
so that it will have more stuff on there as it progresses. But I do a lot of the coaching stuff more in my group, in my Stepping Up.
Yeah, so like everybody seems to be going to Facebook, so it makes sense.
Yeah, I like Facebook. Facebook's great for community, so I really enjoy it.
Very good. Dave James, podiatrist, the magician. Really appreciate you being on the show today.
Thank you. Appreciate being here. It's really cool. Thank you very much.
Well, that wraps up another episode. If you can, send me a review. That's .net/subscribe, Apple, Google, Stitcher, Android devices. You just click that button. It'll take you exactly to the page you need to. You can write a review, hopefully a 5-star review. Like I said, it does help for other people to discover what we're doing here. And one thing I haven't really talked about too much is the adoctorsperspective.net/support page. If you want to host a cup of coffee, go for it. If you want to pledge a little higher fee, there's buttons for that. There's even monthly recurring for those who feel like, wow, this is like the cheapest mentor coach program I've ever seen, because you interview so many different kinds of doctors and I've been able to implement things that I've heard and it works. So monthly recurring payments, which also can get you my books for free, t-shirts for free, the first book, that deals with health and exercise, getting on a diet, getting your financial health in order as well, things I've learned in China. That book is available as well. And one thing that I don't have like a full-blown page about coaching and things, but there's a little button there. I've had people request, hey, doctors and non-doctors asking me, can I do more than just answer a couple of questions? Or could you be my coach for a little while? And I say, yeah, we can do that. So it's something I haven't really advertised, but it's something that I can do, whether it's marketing, some strategies for new patients, growth, those types of topics. If you're interested, just email me, justin@adoctorsperspective.net. If you have any ideas for guests, please send me an email, justin@adoctorsperspective.net. I'd love to hear who you think would be good or a profession that you may not have heard yet. And we've got over 100 episodes. This is going to be like our 3rd year. Super excited. We're going to have a little mini series like we've been doing, which has been fun. Hope you've enjoyed them as well. That's the feedback I've gotten. I want to remind everybody that we have some great affiliate links available. If you're into instrument-assisted soft tissue manipulation, we've got the Edge tool and we got the Hawk grips. Saves you about 10%. Also with the Edge, you've got the blood pressure cuff restriction system. You've got the G Suite inexpensive EMR in case you're doing cash practice. And of course, I got my own electric acupuncture pin to go with the no needle acupuncture book. From time to time, I'll have a bundle set where you can get them all together for a great price. I also have the free downloads at doctorsperspective.net/blueprints. And what lately I've been doing is substituting a 5th one. Like I've done a knee, and depending on the guest, I might do a different type. So check back there. You've got the Primal Paleo grass-fed protein, bone broth style. Save 10% on that. No sugar, allergy-free, gluten-free, dairy-free, all those types of things. Mentor box, get taught by the author. We got set for those floss bands that you may have heard about on one of the episodes. I really like those. If you want to know what hosting I use for podcasting, it's Blueberry. Pure VPN, that's one of those ones I use to help keep my payments secure, as well as access the internet more safely. Any Amazon products that you might want, click the link in the show notes pages. So all those resources can be found at doctorsperspective.net/resources. There's also t-shirts at .net/t-shirts. Put up some new designs from time to time, like making lemons out of lemonade, shrimp po' boy, plus all the chiropractic and podcast swag that you could want. As always, listen, critically think, and implement. Have a great week. We just went #behind the curtain. I hope you will listen and integrate what some of these guests have said. By all means, please share across your social media, write a review, and if you go to the show notes page, you can find all the references for today's guest. You've been listening to Dr. Justin Trosclair, giving you a doctor's perspective.